Welcome to our training on the intersection of harm reduction, medications for opiate use disorder, and the criminal justice system. This training will cover the intersection of harm reduction, medications for the treatment of opiate use disorder, and the criminal justice system. The three presenters will share their knowledge of how opiate use disorder is treated in the criminal justice system, how medications are used to treat opiate use disorder, and the various harm reduction methods used to treat individuals with opiate use disorder. Renee Casey is the Director of Community Corrections and Correctional Reentry Services at the Washtenaw County Sheriff's Office. She obtained her Bachelor of Science in Criminal Justice from the University of Toledo. Renee Casey discusses the high prevalence of opiate use disorder in the county jail system and the efforts being made in Washtenaw County Jail to treat individuals with opiate use disorder and reduce overdose and recidivism rates. Matt Costello is the Program Manager at the Center for Behavioral Health and Justice at Wayne State University's School of Social Work. He obtained his Bachelor of Science in Human Resource Development from Oakland University and his Master of Social Work degree from Wayne State University. Matt Costello provides an overview of medications for opiate use disorder treatment models and wraparound services in the county jail system, and how these services provide a continuity of care for individuals re-entering the community. Dr. Jessica Moreno is a clinical pharmacist specialist with the Integrated Behavioral Health Program at Beaumont Health in Southfield, Michigan. She obtained her Bachelor of Science in Chemical Engineering and her Doctor of Pharmacy degrees from the University of Michigan. Dr. Moreno provides a detailed explanation of opiate use disorder and the various methods of treatment, including recommended prescribed medications. She also discusses opioid overdose management and provides education on harm reduction approaches to improve the outcomes for individuals with opiate use disorder.
Again, thank you everyone for taking the time to join us this morning. We're talking about the intersection of harm reduction, MOUD programs, and the criminal justice system. And for my part of the presentation, we're going to kind of give you a little bit of a corrections criminal justice system 101. And kind of go through the different parts of the system and then really talk about how important it truly is to bring in this idea of harm reduction into the correctional facilities to get those practices, supports, and services started at the earliest point of intervention, and how it's really important to continue to grow out programs of harm reduction within a correctional facility. So that being said, so when people hear the word corrections, traditionally what comes to mind? Do you think of shows like 60 Days In, Orange is the New Black, those types of things, right? So the word correction traditionally takes people automatically to this idea of incarceration, right? An incarcerated setting, a prison, a jail. But there's actually different types of corrections. So there's institutional corrections, which is the one that most people think of when they hear the word, right? Those are our jails and our prisons, our detention centers, our local holding centers or lockups, and then our residential treatment centers. But there's also community corrections, and that doesn't get as much attention, if you will, or it's not necessarily the one that comes to mind when people hear the word, but there is a large part of corrections that exists within the community. And that's everything from our pretrial services to our probation, to parole, to transitional housing. So when you talk about corrections, it's really this broad span that goes well beyond just the institutional settings. And that's important to know and to understand, because when you're talking about treatment services, harm reduction practices, and so on, it's just as important to have those inside the facility as it is to have your practitioners in the community who are supervising the community corrections type programs to be educated and working in those types of areas as well.
3 years ago, when I came to the CBHJ, there were 2 county jails in the state of Michigan that had a full-fledged running MAT program. And that is really a horrible kind of statistic or idea. What the CBHJ has done is look at the sequential intercept model and say, where and how do we kind of get involved in this process? How do we make interventions for particularly the opioid involved individuals inside the correction system? This sequential intercept model is not applicable just to OUD, but is, as you can see, is applicable to really every part of the criminal justice system, whether you be a person with mental health needs, physical needs, or substance use needs. The idea of an individual booking into a jail that Renee just described and having opioids in their systems, what jails typically did was, to meet their constitutional requirements, would manage their withdrawal symptoms as they presented. It is a very ugly kind of scene for a person who is going through cold turkey withdrawals from any kind of opioid. What's even worse is for some of these individuals, the idea that they're going through withdrawals is that they were taking a legitimately prescribed opioid medication prior to the incarceration, or an MAT medication prior to the incarceration, and we're not being given that medication once in the jail. So we already know that most drug overdose, and this has been consistent throughout time, has been overdoses related to opioids. As Renee talked about, the idea of individuals releasing from jails are at really high risks of overdose post-release, because we understand opioids are a tolerance-based medication or substance. And if you've been in jail for any bit of time, your tolerance has changed, and you go back out in the community and use in a manner that was similar to what you were using prior to the incarceration, you will have a high chance of overdosing. Medications for opioid use disorder is recognized as a gold standard of treatment for individuals who are struggling with opioid use disorder. It's a pretty easy process. It's just there's so much stigma involved here, and this is really where that harm reduction element comes into place and has great value for us. As we talked about, as I mentioned just a minute ago, very few jails in the state of Michigan provide MOUD services inside their jail as we would understand or describe it. When I came to the jail center, 2 county jails were having MAT programs or MOUD programs. With the CBHJ, we've onboarded now 9 additional county jails with MOUD programming. So more work to be done, but again, more recognition about the need for this to be done.
Why can't they just stop is a really common question. And for people who don't understand, it's kind of an understandable question. However, what we need to do is do a better job of educating people that there are reasons why people who use drugs who've developed addiction can't just stop. Addiction itself is best understood as a chronic illness. There is some controversy rather as far as calling it a brain disease or a disease in and of itself. However, it still feels fairly accurate to call it a chronic illness. And that chronic illness is characterized by compulsive substance seeking and use despite harmful consequences. So it doesn't matter how many times somebody gets put in jail or how many OWIs somebody gets, or how many times they've been hospitalized because of their substance use. They're using despite those consequences. That in and of itself is the illness. Those harmful consequences are not often enough to make that person stop using. Addiction is associated with persistent and recurring health problems. There isn't a clear cure for it. We have treatments, but we don't really have a clear cure. That said, treatment outcomes are comparable to other chronic illnesses. High blood pressure doesn't have a clear cure. Diabetes doesn't have a clear cure, but we have treatments for them and we treat them for people's entire lives, and people are able to live whole, fulfilling lives as long as they have adequate access to treatment. So because of that, we should approach addiction like we do any other chronic disease. To underscore this even more, if we were to treat addiction with medication treatment like we do with other chronic diseases, people would get even better with their addiction treatment than they do with other chronic diseases. And what I mean when I say that is just by looking at the data. So when people are on opioid agonist treatment, and when I'm referring to opioid agonist treatment, what I mean is methadone or buprenorphine specifically. So methadone or oftentimes buprenorphine is referred to as Suboxone. We see somewhere between a 30 to 50% reduction in positive toxicology screens. So people stop using illicit opioids when they're taking methadone or buprenorphine. There's about a 50% reduction in mortality at 1 year, which is astronomical. We don't see any heart medication treatments giving a 50% reduction in mortality at 1 year. To illustrate that point a little bit more, I just created this very rough schematic to just show what that 50% reduction in mortality means. So if you have on the one side, on the green side, people receiving MOUD medications, let's say there's 100 people in that group. And then on the yellow side, people receiving abstinence-based treatment, which means they are not given any access to MOUD. 100 people in both groups. In the abstinence-based treatment group, let's say, for example, 40 of those people die. Very often, this is all-cause mortality, but very often they're dying of overdoses. That 50% reduction in mortality equates to only 20 people dying in the MOUD treatment arm. So in the MOUD treatment arm, at the end of that 1-year period, 80 people survived. Whereas in the abstinence-based treatment arm, at the end of that 1-year period, 60 people survive. So you have a way better chance of surviving a full year's life if you take MOUD treatment as compared to electing for abstinence-based or being forced into abstinence-based treatment.